This is my journey. Inspired one story at a time, a library of leaders was created. It began as a journey to learn. As time went on, it began to grow. All it needed was a platform, and this podcast was created to listen, to inspire, to share. I am a storyteller, and this is my journey. Welcome to another episode of Profiles in Leadership. I am your host, Steve Anderson, and today our guest is Pedro Teixeira, who is the co-founder of PredictionHealth, which is an AI-powered clinical intelligence company that was acquired by Prompt Health and now leads the AI engineering at Prompt. He combines dual medical and doctoral training with deep biomedical informatics expertise to bring intelligent automation into everyday clinical workflows. By leveraging AI and natural language processing, Pedro helps rehab practices improve documentation accuracy, compliance, billing performance, and operational efficiency, reducing clinical burden while driving better patient and business outcomes. So, Pedro, welcome to the program. It's great to have you on today.
Hey, yeah, no, really appreciate the opportunity. Hopefully I can be interesting and useful.
For sure. So let's just start with a little context. Now, interestingly enough, you're an MD and a PhD, so you must do pretty well in school. So we got that. But tell us a little bit about where you grew up, and then where you went to school, and kind of how you started in this tech world related to healthcare.
Yeah, I think the greatest thing it highlights is I was originally very indecisive. I couldn't pick one or the other. Try to do both, right? Um, so I grew up in Rhode Island, which is a fun little but kind of quirky state. I did my college back at Harvard. I did biochem and comp sci. Comp sci is my minor. And then I had always really wanted to go into medicine and healthcare. My family values health a lot, so they're very sort of like traditional classic folk, and they'd always talk to us about like, oh, like you got to have your health. If you don't have your health, what else do you really have? You're not going to care about anything if you're not healthy. Um, and that really stuck with me. I was nerdy growing up, and I'm maybe even nerdier somehow now.
Okay.
But I decided, oh, health and medicine, take care of patients, and then the computer bug. I got that, especially in college. So I took like one course. It was like the intro to intro, and I was like, oh my God, these computers can just do these crazy things that you can't do. The one that really sort of flipped that switch was cracking passwords. So that was actually an assignment, one of the first ones. It's like, okay, you're going to try to crack passwords, and I remember I coded it up. I hit go, and it just starts trying all of them and showing on the screen all the things it had tried, and it's just like shooting by, and I was just like, wow, like that is just so fast. Like I can't see patients that fast. I can't read patient charts that fast. I can't do anything as fast as the computer can for that thing. And it's like, wow, like that's just this amazing superpower tool that I bet you could make things better in medicine if you use computers. And so with that crazy idea, I applied to do an MD PhD program, and I applied to, I think it was almost 30 different places, and was lucky enough that Vanderbilt, gave me an opportunity to go there, and they have a great biomedical informatics program. And so that was my dream, right? I'm going to get to learn how to take care of patients, but also use computers to do things that humans by themselves can't do. Um, and very first, the interview weekend, I met my co-founder, Ravi Atreya, who also got into the MD PhD program there. And he's a very, very nice guy. And he was comp sci as his major. And for some reason, they decided it'd be a good idea to let two of us nerds in to that class. Um, and we were like really got along and sort of had the same sort of vision. It's like, oh, the computers can do really useful things. And early on, this is like 2000, 9, 2010, we're like, we have an EMR. We have a bunch of data here at Vanderbilt. We can do some really great things for our PhDs. But we really wish that the EMR system seemed actually smart and helpful instead of being something that's kind of like holding us back, and you have to punch in all this data. And I'm sure a lot of your audience can relate that it doesn't always feel like it's helping you. And so when we got to the end of our training, that was this crazy idea we had, was maybe we should try to build stuff. Uh, and that's actually what we went off to try to do. It started our company, Prediction Health, to try to build that smart system right into the electronic systems that folks were using. Um, so that hopefully they could do a better job taking care of patients and take advantage of some of the great properties, right? The great skills that computers have, because they are really good at something that people aren't, but also people are really great at a lot of things that computers aren't good at either. So that's the initial
So
story.
you went right from medical school, getting that degree, and then right into the tech world. So you didn't actually treat any patients or go through that process.
I got all the way up to where I would applied to internship and residency. So I did my like away rotations and everything. And the deal we had with Vanderbilt, and they were very smart. They're like, hey, this is kind of a risky idea you all are doing. You're probably going to fail. And we were like, yes, we know. So they say,
Okay.
like, how about you do a leave of absence? And then when this thing doesn't work out, you come back and apply and go off to residency like a normal person. And we're like, that sounds like a good idea. We really appreciate that. And so we did a year of leave and we got one other year leave of absence because we're like, we're kind of made a little progress. And then they were like, okay, you guys got to pick. So like get out or come back. And at that point, we're like, you know what? We're going to keep going until this thing fails or, maybe it won't. It didn't fail. So here we are like 9 years later. But
Amazing.
yeah,
So two of you get together to come up with this concept, build this company. So I understand the concept that you're trying to do, but building a company is a whole different thing. It takes business acumen, building teams, whatever. So where were you based and how did you start that process? Was it just the two of you, or did you hire other people to help you through that piece of it?
so really early on, we had one other co-founder, Michael Poku, who was in the MD program there. But it was just me and Ravi. So I think it was like January 2nd, 2017. The plan was I'm going to show up at your house, Ravi, and he had a spare room, and we're just going to like set up our laptops and have our computers and our table set up. He had a bunch of whiteboard paper on the wall, not even like actually like a whiteboard. It was just like that paper that you just stick on like a gigantic sticky that's whiteboard paper, and that was it. And we're just like we're going to try to build something here, and we started writing code and having all these ideas. We had thought about it a lot before, but it was just literally us. And that entire first year, which is perhaps one of the most important lessons I can share with other people. We didn't go and actually try to like sell something to somebody to really use. We would do demos of the software that we had been building, but without asking the question of like, hey, would you buy this? Would you really use this in clinic? Would you, give us money for it? They would say really nice things, which was great. It's very, very kind of them. They're trying to be kind, but then they wouldn't give us the actual important feedback that we needed, that like this is a dead end, right? Like we were trying to do a tablet application at that point, but they already had a laptop. So folks would be, oh, this is amazing. It's a great UI. It's very interesting. This would be so fun to use. But they wouldn't answer to like, well, but like, I'm not going to use this because I already have my laptop. You have to figure out a way to just have this work without me carrying around another device, which sounds like a dumb idea or a dumb idea. Well, it was a dumb idea. But it was just kind of that type of thing. Without really pushing people to think about actually using something in their day to day, they won't give you the feedback that you really need, which can often be kind of harsh. And so they don't want to hurt your feelings, right? But then we wasted a lot of time building things that weren't actually going to make it out into people's workflows to help them actually take care of patients.
So how did you fund this? Did you get angel financing? Did you go to the private equity route? Did you guys just eat canned soup for a year? I mean, how does this, how did you get this off the ground?
We had to be very cheap for a very long time. So we would consult on weekends. So we would like work all week and maybe sometimes on Saturdays, coding things up, trying to get meetings scheduled with customers. And then on the weekends, we would consult to cover rent. And that went on for like basically that entire first year and into the second. And then we had started making a little bit of progress. So we did a SAFE. So YC has this program, the startup school, and a lot of free materials, and including like the SAFE document, which is still, I believe, the standard for a lot of early stage startups. Just very simple standard language. And we did get a few angels to put a little bit of money in, and we won a pitch competition, which made a huge difference for us. It was like $25,000, which was amazing because before that, again, we had literally nothing. and and that was about August of 2018. Um, so then we could finally hire like our first employee and a curator. It was someone that would listen into the audio because at that point we had realized, oh, people don't want to use some crazy app that we've built to then document in yet another system. They want to be able to have the system listen to their case and then just write their notes for them, because that's literally what people would tell us once we asked, well, like, what would you pay for? They said, can you just write our notes for us? So we're like, well, maybe if we have humans somewhere and we pipe the audio over to them securely, and then we could over time have the AI take that over, right? So that's what we use that initial cash prize for, was that we hire a curator. We hired our first employee to help kind of manage that and also curate cases. So it wasn't always us. And that was kind of the beginning of it. And eventually we got into an accelerator called Mucker Labs, which helped. That was end of 2018. So we had like a little bit more funding in place. But the
Okay.
early stage was very rough.
So to break this down to the very simple aspects, so you're building a program that basically, as a clinician who's treating patients, I walk into a room, I have a conversation with that patient, I do some techniques or some procedures and whatever, and the machine is recording that and putting that together and making a note that I can use it in my medical record that will also help me with compliance billing and so on. Did I say that right?
That's all accurate. In that early stage, though, the one thing that we didn't have yet was the compliance, because we actually started in not physical therapy. So we started in primary care, urology, um, behavioral health, and PT. We kind of bumped into early on because Ben Sharp, who ended up becoming one of our investors and everything, was CEO over at RET, and he reached out to us and he said, "Hey, do you guys do PT?" And at that point, again, we're really early. We just want anybody to use our software. And so I said, yes, we can totally cover that. And I flew out to Seattle and I
Yeah.
showed up and actually met Kelly Brown, who ended up joining our team. And she was our first user. And so she actually explained to us, hey, we need the notes to be, of course, thorough and appropriate. They have to be compliant. And it's just like, oh, that's interesting. Like, what is that? You don't have
What is
to,
compliance?
do that. Yeah, right, exactly. So we learned a lot from her and about PT. And then the compliance problem was very actually useful to us, because it was the kind of thing that we could train the AI models to do a really good job of much sooner than having an AI model that listens to a really ambiguous conversation and writes an entire note. So the compliance problem that PT has kind of pulled us into that specialty, because it was something very special that we could cover really, really well. And then over time, add in a fully automated AI documentation system as well.
That's great. Now, is Ben still involved in the company?
He's always been like a great advisor and mentor. He got to dodge a lot of the chaos, fortunately, perhaps for him. But
Yeah.
but no, he was a great person to know, because he's also very entrepreneurial and just like also a very, very nice person.
He was definitely a unicorn in the PT world, a great guy.
Mhm.
Know him well, and he just was one of those guys that came in and ran that company, but from a very different perspective than what most PT companies' mindset was run by. So he
Yeah.
was great for the profession, and sounds like he was great for your company as well.
Yeah, I mean, he's got an eye, I think, for finding kind of wacky people that have a potential to do something interesting. So we were very, very lucky to bump into him back in, yeah, again, it was 2019. Yeah.
That's great. Okay, so you put this company together called Prediction Health. You've got some employees now. You're starting to build the machine, so to speak, or the software. And was it a hard sell? I mean, I've been a physical therapist my whole life, and I've been around, and sometimes, it's hard to convince people to spend some money in an area that like this, and that's
Mhm.
not an easy sell. So, how do you think you connected, and why did you connect, and how did this go for
Mhm. Yeah. So one of the nice things was that notes, like writing your own notes or doing all this like peer-to-peer review and making sure that you're compliant, neither one of those are things that people like to do, right? So we didn't have a lot of market risk. Like the thing would be very desirable if we could build it and build it so that we could scale it. The risk that we all kind of had for the vast majority of our history was technical risk, as in, can we build this and have it be good enough and high quality and automated enough that we can offer it at a price point that people can afford? Because of course, rehab therapy, very tight margins, lots of like difficult things about running a business there. And so it was a very desirable product, but it was a question of like, can we get it to be cost effective enough for people to be able to deploy it in their clinics? And that was kind of our key challenge. And we really lucked out because like we had seen again we're nerds, right? We feel like this AI technology is going to be something huge, but because we're nerds, we're also very optimistic, right? You sort of see where things are going to go, and you think you're going to get there a lot faster than you actually do. um, and so ChatGPT is like big moments like what, 2020, 2022, 2023, and they had been releasing the GPT models out. And I actually even not played with, I actually tried to build a system using GPT-2, which to the folks probably don't mean, it doesn't mean too much, but like this is like, year, 2 years before the big ChatGPT moment. And people today are, I think, very impressed by the technology and use it for a lot of things. But GPT-2 was not smart, like at all. It was terrible. And you could see where it was going, but it just like wouldn't do a good enough job of processing the conversation. So I tried all these crazy tricks to get it to be accurate enough to use, but it just like wasn't there yet. And that was our really big blockers. Like if we could build this, people would love this. It'd make them very happy. It'll deliver so much value. But technically, it took a while, right? In several years, right? We're talking like 4 or 5 years after we started to finally get to the point where the technology was where we wanted it to be. And so once we got there, we got to really sort of have a great wave of growth and progress. But it was very tough getting to that point.
Well, not only that, as you know, I've been in PT for a long time, so I know that going way back to the early EMRs and the systems that were there, it was like, oh, this is going to save you time. This is going to make your life easier. And every program that came in was going to save us time, and it never saved any time. So I'm sure there's a huge skepticism there of, okay, now this guy's going to say that he's going to save us time. We've heard this story before, so it's a tough sell. Now,
Yeah.
looking back on it with AI, we can see the difference. But I would think in the initial stages there, it was kind of, you probably got a lot of, yeah, we've heard this before.
Yeah, right. It's 100% true, and that was part of the reason we actually had to, in the again very early days, we had humans looped in because, of course, like a human, like there's like real human scribes, right? And so they can listen to a conversation, they can do it, but then the price point was obviously not something that would make sense in rehab therapy. We got to learn a lot from that. It was a very difficult problem. It was a difficult organizational problem too, because now we're having to hire dozens and dozens of human scribes and train them and manage them. The pandemic hit in the middle of all of this, which was obviously made things worse. And funny enough, we had signed volume-based contracts in PT for that early solution. And so the pandemic hits, and I think 60, 70% of the cases just like disappear overnight. And I have all these people that we'd hired up and trained, which was just kind of this insane time period. But yeah, that was a lot of learnings and a lot of difficult times, but a lot of really formative experiences that set us up to do really, really well once the technology finally did get to the point that you could get it to do the task.
So, are you exclusively in the rehab world now, or are you still dabbling in medicine, general practice, other parts of healthcare?
So, um, because of the compliance tool, and then we built, of course, the CPT insights, predictor, so something that would help understand if you're accurately encoding the CPT codes based on what you're actually writing in the chart. It was just a really great opportunity for us to not just be the AI scribe, but to actually be a more vertically integrated solution. So we would be able to do the compliance with those models. We'd be able to assist with the CPT coding, and then also do the documentation. And that sort of stacking of things made it really special for the rehab therapy space and was something that we felt was better and more useful for the therapist for us to double down and really focus on doing well in the rehab therapy space than to try to just keep adding different verticals where you'd never be as deep as if you really focused in on one. And that's served us pretty well.
Yeah, it sounds like it. So, you Prediction Health. So, before you joined Prompt, how big was the organization? How many employees did you have at Prediction Health before you sold to Prompt?
And we got to about 40 folks, which, from two guys in a spare bedroom to 40 folks is pretty good.
That's great. Okay, so and why go to Prompt Health at that point? What was the reason for doing that, and what's happened since?
No. So our great sort of like run of growth. was based on listening to folks in therapy, right? Like that from that very first conversation back in 2019 or so of like, oh yeah, they have to be compliant notes and like being inquisitive and asking, right? Like, oh, tell me more about that. Every time we built something that folks told us they really would need and would help them, it made a huge difference for us. So it was compliance, then it was CPT coding, and then of course it was always documentation too. Um, and we built those things, we integrated them together, and we were able to grow really, really well. And there was also a lot of requests to do things like, can you integrate into the EMR more deeply so that you can do like the structured fields? Could you eventually help with billing? Could you help with scheduling? So we start getting all these questions or requests that made a lot of sense, that would be very, very valuable, but that were very difficult to do if you were just a vendor trying to be on top of the EMR versus being actually integrated more tightly with one. And I've actually known Mike Dwyer since 2020, where I found out actually he was very close to me. He's over in like Paramus, and it's like, oh wait, you're over there. Like that's like half an hour away. Um, and so we've known each other for a while. We've talked. I've gotten to see Prompt really make great progress and deliver a great EMR that I think improved on a lot of things. And it just made a lot of sense for us to finally build those other things that customers really wanted, to have that deeper integration of the AI into their workflows so that it's not just helping write the notes, but now helping in all the other ways that you could imagine AI being useful in an EMR. It was just like an opportunity too great to pass up. And we also really like the Prompt team. They're really great people that we've really always loved working with. We've been partners for years. And so it just kind of like the stars aligned and it just kind of like made sense for us.
So how did you integrate into that bigger organization then? You were the founder, CEO of Prediction Health. Now you're a part of Prompt. So what is your role there? What is your title there in the bigger organization?
So I am now VP of AI engineering. And so I get to oversee all of the AI initiatives here at Prompt. So the integration, of course, with Sidekick and our Practice Intel, now Prompt Insight tool to give the analytics back to folks. And we've only been here, let's see, since about June, right? So we're like almost 5-ish months now. So it's still early, and so we have a lot more things coming, but it's going to be a lot of opportunities to integrate AI now across all of the EMR services and tools, and to help not just the clinician, but to be able to help admins, billers, the patient maybe more directly with some services. So very, very excited about it. I love getting to focus in on product, and there's a lot of opportunities to help people. Being able to now expand out from not just the clinical aspect, but into a lot of other roles.
So we can make the argument that the physical therapy or rehab world is kind of small in numbers compared to the bigger business world. How many users do you have, or what is the percentage of people in that field that are using, your product or your company? Can you give us an idea of that?
Yeah, we have many, many thousands of active users every single week, which is really, really great. Of course, Prompt is also actively growing. And so we get to sort of like work together to capture more and more of the market share. But yeah, it's a long ways from our early days when I think we got to, dozens of clinicians. It's pretty satisfying to get to, thousands and tens of thousands of people that you get to help every week.
Well, I can tell you just from what I've seen is that people that do use the product are really happy with it. They think it actually does save them time, and it's a game changer. So I mean that's what a tech guy wants to hear, right?
Yeah, no, it means just honestly so, so much, right? Because we talked about the early days and the spare room and building things that nobody wants to use. And to have those years of sort of searching around in the forest to figure out what in the world can we do that's actually helpful. And to finally get to the point where you have really, passionate users, sometimes folks getting a little bit teary-eyed about it, just means a lot to know that we finally figured out ways to help people and help people that are taking care of patients, which I really liked taking care of patients, but my sort of special calling, I think, was building tools for the people that then go off and take care of patients, and it's very satisfying.
So let's talk a little bit about, if you don't mind going down this path a little bit. So we know what an EMR is, electronic medical record, but there's also an EHR, which is the electronic health record,
Mhm.
which is tied into the bigger um, network of information that a medical practitioner can get to. Physical therapy traditionally has been much more in the EMR world and kind of not included in the EHR world. So, how do you see prompt getting into the EHR world? And if I didn't explain that quite right, feel free to make sure you explain it better. But but the future of this, I would think, would need to get into the EHR world as well, correct?
Yeah, so there's all this like additional integrations, sort of like this broader context that you have to have, certifications that one has to do, of course, to be a certified EHR. And I think strategically, a lot of folks actually start in the EMR space because there's, fewer things you have to do. You can kind of start a little bit more of a tight, use case, and you can expand out. And I think, of course, just to support more and more people and organizations that want to have more integrations into other health systems, other systems, et cetera, into information exchanges, that's a trend, right, that you're going to want to do. And I think also kind of special to my role and my experience is that as you get more information and more integration into these other systems, you now also have more data. And you want for AI systems to have access to more data, of course, to use in a de identified and appropriate way. But you want to do that because the more you can learn about a patient, the better the system is going to become at figuring out what's the best way to take care of this person. And so, from, of course, just like a natural maturation perspective, but also as a way to get more data so that the system can be more helpful to take care of patients. There's just like this very strong force pushing towards having this broader integration and going more towards the EHR as opposed to the EMR stage.
So think of it this way. I was, part of Therapeutic Associates and CEO of that company, and we made a decision early on to go with Athena Health because they
Mhm.
were an EHR. And we felt that was the future and that's where we needed to be. And so probably a little ahead of ourselves getting into that, but I think most people would agree that was a good move. So they would come to you and basically say, can you integrate your system into that system? So just tell me how that would work and how that did work and how do you make that happen? Because there's proprietary things, there's security things, there's, are you
Mhm.
big enough to really cause all this extra work for the EHR? How does it work?
Yeah, so the integration thing in healthcare is one of the most hairy, like challenging problems, but also so important because, again, like if you're going to get a referral, you're going to work with somebody, if you're going to work across health systems, having access to the information, right, and being able to share that in a sort of very seamless way is critical. But because of the way it's set up, and even if you have something like a fire standard, or you're gonna use that as your interoperability, or HL7, et cetera, there's always like the name, and it's like, oh, we're all going to use, insert the name of the interoperability standard we're going to use, but then they always leave enough ambiguity that people will implement them in different ways. And so as you want to add more of these connections to other systems, and have that interoperability, you have to then deal with all of this mess where like, okay, yeah, it's coming through as, insert, it's a fire message, it's an HL7 message, whatever. But then within each of those packages, right, the content inside is always such a mess that it's not always the exact same format, the exact same way. And so what we're seeing is if you're going through to do more and more of those integrations, you have to keep doing this not trivial work of like how do we map all the things together so the messages get passed and the information is landing in the right place. And so that's that's the real big, I think, challenge. And there isn't one system or sort of like one pattern to solve all of this. It's just that like you go to a new system, even if the EMR is the same or the EHR is the same and they have the same API, the contents that actually inside of the API is not always consistent. And so that's, I think, the thing that really holds us back and that prevents having like a really nice seamless integration across all the different health systems. But it's also something that there's not like a clean solution to it yet, and I don't see a good path to that. And hopefully, I'm not getting too technical or like too nerdy, but like that's something that we, as an entity that was outside of EMRs, had to deal with a lot personally, right? Because we had to connect to the EMR in some sort of fashion to be able to take the node information out and then put the node information back in. So we were very intimately aware of all the edge cases and nests in getting information in and out from any system.
So one of the big fears when you run a company is there's so much going on, people are so busy, there's no time to do other things. So if I'm going to bring your system into my company, my first thought is, oh my gosh, who's going to train these people? And then do we have time to do it? What happens to our revenue during that time? So how do you train companies that use your product now and get them to the point where it's are getting a good return on their investment?
You know? So, as I'm sure all of your listeners have seen, right, is that just because it's technology doesn't mean it's easy to use, right? You have to really sit with something and keep pushing on it and try to like smooth out the edges for it to become a technology that's simple to use. And so we think about this in two buckets. One is the technology itself. Like, and we've made it so that you log in and for various different systems, it's one button to start the reporting for the patient that you just pull up on within your system, and then you hit one button to stop it, and then it just shows up. And then you just see the notes there. And if you like the content, you can just click per section to insert it in. So we've made it as simple as possible to use. And we have, of course, some videos showing optimal usage for it. We have it embedded in that product. We have it in separate information resources that we send out to every single group. But one is again, just really focusing on the product. How do we remove every single step we possibly can? And I think that we can still make it better, but that was one really big focus for us. The second side, though, is the product all by itself isn't going to just solve everything. And we focused a lot on having a great customer success team that I think basically all of them, yeah, in our prediction health days were formerly therapists. So they know very intimately what it's like to see patients and what the therapists are going to be thinking. And we try very hard to kind of like walk folks through where we communicate to them, we walk them through here's how to use it, we answer the questions, we identify a clinical champion at each site whenever possible, because it makes a really big difference to have someone in the organization who's interested in this type of thing, but then also intimately understands the organization. Because there's always going to be those little bits of question like, oh, in our clinic, we set our gyms up like this, which means, we always listen to music. So then how do we sort of set up the laptop so that it can hear the therapist really clearly, even though people are running around listening to music and, banging equipment around, right? Um, so having that clinical champion that understands the organization and then also learns how to use the tool and then can answer questions, but as to, to their peers, to their colleagues in that organization makes a really big difference. And then we just have like this very thorough follow up with people. These onboarding sessions, we're always available to answer questions. They can message us through the tool or straight to the messaging portal, and then talk to someone who, again, has that clinical background, who has the experience, of course, with the tools as well, and that can answer in a way that um, they're appreciating the complexity of taking care of patients and being a therapist in the PT and the rehab therapy space, where there's again a lot of stuff going on, a lot of things you need to remember to do with your note, and you want it to be efficient and actually helpful too, right? So a lot of things to consider.
And you said earlier you talked about a laptop. So is that the main machine you use when you're using the system, or do you have or can you use an iPad or a tablet or other things?
No. So we've
Or
seen a
your phone?
huge array. Yeah, and the phone, right? So we've seen a huge array. The most common is laptop, because again, that's what you people are usually using to access their EMR. And to that original lesson was just like, don't have me do a second thing. Like if I'm using a laptop, then support this in my laptop in my EMR that I'm already using. And so that's the most common by far. But we have people that use iPads. We have people that use Macs or they use PCs or they use Chromebooks, right? We have a native mobile application now because some people are running around or they're doing home visits, et cetera. They wanted a mobile solution, and so we have now implemented that as well. So we covered the gamut of basically all the devices now, from phone all the way to a laptop, and it took a while to add all of those. But again, we listened to the folks, and wherever they needed us, if there were enough folks that wanted to use that device, we did our best to support them in that.
So let's talk about Prompt a little bit now as a company. How large a organization is it? How many employees? What's the executive staff look like? Just give me an idea what that
Hmm.
company looks like from a business perspective.
Yeah, so it's a big jump up from us, right? From our 40-ish people. They're hundreds, right? They're on the order of 10 times larger than we were. I mean, I guess now included into them. Um, and then really great executive team to work with. But that's the rough order of magnitude on size.
And so as the company moves forward, what do you think, what's the emphasis on building next? Do you just keep improving the product? Do you go to other markets? Do you look for other pieces to tack on to it? What's
Mm.
the future of prompt look like?
Yeah. So similar to us, which again, you want to have ideally good alignment of values when you're joining companies if you want to have a successful outcome. We focus, of course, on listening to our customers a lot. They, really do the same thing. They want to make sure that the healthcare businesses and their patients have extraordinary outcomes. And so, what does that mean? Well, the way to make that easiest, I think, is really building on that vertical integration of solutions for everything that's really, really critical: billing, admin, scheduling, the clinical aspect, coordination with the patient, being able to engage them, right? So that they are doing their HEP, they're getting scheduled, they're completing their plan of care. You just want to keep adding on successfully more and more of the key functionalities that a PT organization needs to have so that they can take great care of the patients, right? And and a lot of that can be powered by technology and AI. Very often you need a great support team. So they have, I think, a fantastic support team, which they invest very, very heavily in so that they can support people and walk them through the transition in EMRs, which is not a trivial thing to do at all, but it's very, very important, right? If you have a great system that supports you and helps you get things done and take care of your patients, it really magnifies everything you do. So that I really appreciate and respect their investment as well into the customer success side of things. And so what you'll see is this continued addition of these key features, doing more automation and more integration across all the things that you'd want to do to take great care of your patients and make sure they complete their plans of care. And then they tell other people about how successful they were at the organization they went to get great care so that they refer and get even more patients in. When unfortunately, sometimes you need some rehab therapy, and it's great that there's organizations to do that.
So when you're building this vertical growth that you're talking about, let's just take something. Let's say, for instance, verification of benefits or making sure their insurance is correct. And do you build that yourself into the system, or do you go out and find other companies that are working on that piece and tag them into your system, whether it's either purchase them or maybe just do a collaborative contract with them? What's your philosophy of building that total vertical system?
Yeah. So, I mean, for some things, it makes sense to partner. Obviously, Prediction Health was a good option for them, and we ended up working together and were acquired in and merged in because we had that alignment of the team, right? That was something they wanted to include in their company, and also a really critical functionality that made sense to pull in really, really deeply. For some things like verifications, right, there's P-Verify, which we can have sort of wired in to support people for verifications. But there's a lot. I mean, the complexity of the entire RCM billing side is very, very large, right? So there is a lot more opportunity to automate and use AI in some cases to pull that in more and more. And it then becomes sort of a question for each one. Is this a durable advantage? Is something worthwhile for us specifically to build? Or is there a vendor that offers a good service that's available, that's of an appropriate right cost pro con or cost effectiveness benefit that we can wire into the solution and save the effort? And so it really just depends on every single individual piece as to whether or not you do a deeper integration or an acquisition or build it yourself. Yeah. So there's not like one answer that rules it all. I find that the team does a really good job of assessing each thing individually and putting some math to it as well, which I know you have a lot of leaders that listen in here. And I always recommend people, and I know math can be scary, but even just simple napkin math at whenever you're making each one of those sort of pro con decisions and quantifying the risks versus the benefits, even just within a very rough order of magnitude, is, I think, really key as a leader so that you can make good, confident decisions. Because otherwise, shooting from the hip is a bit risky, right? Math, I think, clarifies a lot of things.
So you don't build a business like this unless you have some leadership skills. And I've heard you say multiple times, you listen to the customer. You're a listener. I consider that a leadership skill. So that is one. What other leadership, when you look at yourself and how you're doing what you do now and how you built this company, what is your leadership style and how do you leverage that?
You know, so um, I actually tell my son this all the time. But step one is stay calm. Step two is understand the problem. And then if you understand the problem really well, step three is going to be easy. It's going to be solve the problem, right? So step one, right, you stay calm. And in leadership, you're faced with a lot of difficult decisions, difficult conversations, difficult situations where if you get kind of riled up and too emotional, it makes it very difficult to then use your brain and think clearly. And so that's the prerequisite. But then the listening, I think, is really key to being able to understand the problem. Because if you listen to people, they will tell you useful things. Now, they might not always just literally tell you the solution, but they'll tell you, here's what the problems are, here's what I see. And I think a key skill to a leader is being able to do that across a lot of different people and a lot of different roles. And then you want to be able to sort of synthesize that down. And if you do that well enough and you are curious and you ask those follow-up questions, you can end up understanding your problem. And that usually also includes not just like, here's the problem today, but here's what that problem could become. Here are the incentive structures. Here's why someone is doing this, right? So there's always like what they're doing that causes the problem. When we talk to users, for example, they'll be like, oh, I maybe don't like this as much for a daily visit. Like, oh, that's interesting. Like, tell me why. And there's their workflow or their incentive structure. Maybe they have to finish their notes by the end of the day. That will require certain things, right? So that inquisitiveness to understand the problem is really key. And once you do that, the solution usually kind of like really falls out of it. And so the listening, is a key skill, but it's to then understand the problem. And I think that sort of sequence of things gets you very, very far. If you just stay calm, listen, but listen to understand. And then get to a point where if you really really get it, the solution, which is the goal, right, you don't want to shortcut to it, then becomes very obvious and then you can act towards it. The other really nice thing is as a leader you have to just make a call at some point, and because you're leading other people, the impact, the bad or the good, right, for your decisions can be very significant. And having more depth of understanding, and if there's a little bit of math thrown in, a little bit more rigor to your call can be really helpful. Ideally, you should actually be able to explain it to other people. So I try not to, just boss people around. If I've done my homework to understand a problem, and if I can then ideally put down some numbers or some very clear logic for like why we're going to do something, I find that you can usually just explain that to other rational people and they'd go, okay. And if they don't agree, if you have a really good team around you, they should be able to push back and say specifically, what about your logic or your math they disagree with? And sometimes they're right too, right? They might see something that you didn't expect. And if you present your reasoning to them in this kind of like rigorous and more transparent way, sometimes you sort of get saved from making bad decisions because they find that you did make a mistake. There was something off, and a little humility to then adjust, change the plan, and then go forward based on that refined version of the plan is very helpful too.
That process that you just went through is great leadership teamwork, so to speak. You're hiring clinicians, technical people, business
Mhm.
people. You just can't assume that that's going to happen organically. So what do you do inside the company as a whole to make sure you've got that leadership training?
Yeah. So I, I mean, of course, now I've joined them more recently, so it's a little bit, different, and I don't want to speak too much for them in their systems. But leading up to this, and for our team, I was involved in basically every single hire, and so I always looked for a great temperament, like nice people that I was going to want to spend time around, because when you're on a team, you're spending a lot of time with people. But then, did they have the aptitude and sort of like that ability to assess a problem, to think about it critically, to then to explain back whatever that thing is, right? Like, okay, here's why I think we should do this, and being able to communicate the reason for decisions, even just in a quick little interview process, says a lot about how well someone can think about different problems. And then you want to really poke at them. Like you want to try to like take the situation and figure out like where it breaks to see if then they will change. Because it's one thing to analyze a situation and come up with a reasonable solution to it, right? And showing that you can think critically about something. But then if you throw them a curveball and now they have to change, right? There's this mental flexibility that we found to be a very critical skill for everybody that we hired onto the team. And not everybody that can describe a thoughtful solution, right? And then adjust on the fly. And especially in a very fast moving startup, That is the last key characteristic or skill that we look for. We look for the ability to like be very adaptable. So you're rigorous, you're thorough. Here's the way I could do it. Here's why, and that all makes sense. And then if you throw them a curveball, the really amazing people on the team are able to just on the fly reincorporate that and update their thinking and explain how their thinking changed based on the curveball that you just threw them. And that's like the last key thing. I believe the prompt team does a good job of that as well. But again, I'm newer here and haven't been as involved in those hires yet as I have for all of our original team members.
So I assume that you're probably just coming off a APTA private practice meeting and
Mhm.
you go to combined sections meeting. And what are you hearing from clinicians that come through the exhibit hall and look at your product and hear about your product? What's the trend? What are people excited about? What are they looking for?
Yeah. No, I thought one of the key underlying goals, and we had a phenomenal PPS. I had such a blast getting to see everybody again, of course, and getting to spend a lot of quality time with customers. And a lot of them shared this desire for like an all-in-one. So they don't want to have to think through a bunch of different vendors and options for things and having to cobble together their solution. They appreciate when someone thoughtfully combines things, again, to sort of that vertical stack, right? Thoughtfully combines all the things they need into like one really well integrated solution. And some of the things that we were super proud to get to present to them, having only had a few months here to integrate things in, was the structured data insertion for our visit. Of course, you do an objective exam, you have range of motions, you have strengths. Traditionally, you'd have to go and click through all those fields in the EMR to fill that out. And that's a feature that people asked us to include in Sidekick forever. And so we actually got to demo that and share that with some people at PPS, and their eyes just like lit up because that's something they wanted, right? That's taking what would have been 5, 10, 20, 30 clicks of information in different places and turning it into, I just mentioned this to my patient, and now it's just showing up here, and I just accept it, and it fills in all those little spots, for them, right? Removing all those little extra tasks that they would have to do into one more seamlessly integrated step. So it was good to get to like put that in people's hands and see their responses to it, and take another step towards giving people more of like an all-in-one solution that incorporates everything they would need to run their organization in one great solution.
Pedro, in anticipation of our discussion today, we've talked a lot about a lot of things. What haven't I asked you or what haven't we covered that you want to be sure and get in the program today?
I think that it could be helpful. Because so of course, I'm an AI nerd. I get the question all the time about AI. It's like, oh, what should I know? How do I use it really well? Or what do we need to know in our practice? And I really like to tell people that the best way to learn is to try, is to do, right? It's also kind of how you end up running a startup or starting a business, so that you're like naive enough maybe to just say like, hey, like I'm gonna go try. And I think that because the AI technology is new, and because it's a bit mysterious, that folks are a little bit hesitant to try it out. And so I really just want to encourage people, hey, it's not going to bite you. You can do it in a chatbot. You can use a bunch of different tools, and you can try it out and like see where it works out. You could use it in your personal life. You can, for labs, you can generate pictures, you can generate videos now, you can even generate music, and just kind of try things out, explore the tool, and intentionally look for cases where it kind of like fails, because that's where you'll sort of learn the most. You'll see like, oh, actually, I couldn't handle that. And maybe when a new model comes out, you can test that again. You can try it for note taking. You can try it for writing blog posts. I really, really want to encourage people with these technologies. They're very powerful and they're very useful. But honestly, nobody knows exactly what the best way is to use them. They're so complex and so advanced that I learn stuff all the time, every week, from different people on our team, from different clinicians, on how they're able to do new exciting things that helps them in their day-to-day life. So that's what I really would love to leave people with, is go try out the AI tools, and learn from them. You probably will discover something that's exciting and useful to you that nobody else has even thought of yet.
So you didn't start out heading towards the physical therapy world or the rehab world, but you're in it pretty much exclusively now.
Right.
What's your feel? Are you optimistic on the profession and where we're going, and can we still do the things we want to do, even though we got this healthcare system that we can all agree is kind of broken sometimes? So what is your outside exposure to the physical therapy world. Now you're inside it. What do you feel about the future?
So the most striking, I think, wonderful thing is that the people in the rehab therapy space are just phenomenal. They really care about their patients. They care about each other. I again, like we didn't try to come into the PT space, right? We kind of stumbled in, and we are so thankful that we get to work with such nice people. And PPS again is like the condensed version of that. Is just we get to bump into all these wonderful folks we've gotten to meet over years that have been really, really helpful. And I think that's very striking from again someone who used to be in a very different space. There's something very special about rehab therapy with regards to the people. Now, the healthcare system, the incentives are terribly misaligned. Every year, things get a lot more challenging for folks from an operational perspective. I don't necessarily have a solution for that. I think that is very, very tough. Again, on a very amazing group of people. But I do see a glimmer of hope in that, for example, for burnout, burnout's been very, very bad. It was maybe especially bad right around the pandemic, and maybe it's gotten a little bit better, but it's still worse than in the 2000 teens. And um, that's very, very challenging. But I have seen a few glimmers in that like people have come back. So I know several anecdotes of folks that have actually come back into the therapy space to see patients again because of some of the new technologies and tools that are available, that they figured out how to use them and get sufficient benefit. And I do see some organizations, despite all of the financial and margin pressures, are using tools, are using sort of new tricks and abilities to be able to deal with that and be actually successful. And so the environment is very, very tough, but there are some glimmers of hope and some tools, some organizations that are showing that they can be successful in that tough space. And again, some great, great anecdotal stories of folks that have come back to seeing patients, which always makes me so sad to hear that like someone stopped seeing patients because of all of the grind, and pressure. Um, and because it's such a rewarding, wonderful thing to do. And so now to see the tide at least slightly turning back, right? Because some people are taking advantage of, again, like the AI scribing tools is a good example, regardless of who you decide to use, like getting that kind of a benefit so you can have such a rewarding career with patients is really, really awesome to see.
That's great. Well, Pedro, at this time in the interview, I always ask my guests the same common question. And that question is in relation to leadership. What is a pearl of wisdom that you could leave us with today?
Mm. I would say to do your best to lead by example. People don't always do what you say, but they will see what you are doing and they will very often emulate the same. And especially if you need folks to do something hard, which that's when the real challenge in leadership comes, is not when you have to ask somebody to do something easy, right? That's a cakewalk. But when you need folks to work hard or to do something difficult, leading by what you have done and by your actions, I think is really the key thing to do. And here I say it, so maybe you don't pay too much attention to the words, right? But maybe look back and you can ask my team and whether or not I did the things that I asked them to do, and hopefully they would say yes. But I think that's one of the keys. And it's not an easy hack, it's not a shortcut, but I think it's very true and very impactful.
I'm curious too, one last question here, but I'm curious when you shared with us how you started out in the spare room of your friend's house and you had a lot of sacrifice and you were just scraping by at that point and then you had some success and you're coming along, but with that comes tons of pressure, lots of uncertainty, and then you joined Prompt and came in that. So is your psyche now or your mindset now relief that now you're with a big organization, you can, relax a little bit and do things in a different way? Or is the pressure cooker still there and it's just in a different way?
We have my co-founder and I have a mentor, Jim Soar, who ended up being one of our investors long term as well. And he says, it doesn't get easier, you just get to go faster. And right, it was like a classic like Tour de France, sort of quote, right? And I just it's so funny because it's been years and years and years now since he first told us that, and he's absolutely right. I've never seen it actually get easier. And so, now do we have certain risks or issues or resource constraints removed to a degree? Yes, but now more than ever, I think the responsibility from all of these additional resources and the new things that are open to us pushes on us even more to go and make the advancements necessary to really help all the folks, right? Like they love using the AI scribe, but they tell us that it makes such a difference in their life. And now we have all of these wonderful things we can go that make even more of a difference to them, right? And to their patients and completing their plans of care and helping them with billing, which is a very difficult, total nightmare of a system. And so I'm both more excited than ever, but also feel even more urgently pushed forward to make progress on those things. And so again, like we just got to go even faster. We can, I think, help even more people. And I'm very cognizant of every day that it takes to get some new thing launched or a new feature launched that like that could have been helping somebody yesterday or the day before. So I feel a lot of actual urgency, even though some things have gotten better, but a lot of urgency to make more progress.
Well, thanks for sharing that. That's very insightful. Pedro, this has been a real pleasure. I've learned a lot. It's great talking to you. You're creating some wonderful things in our industry. People are excited about it. And I'll just give you a plug here, but it's true. You didn't ask me to say this, but people really love the product from what I've seen, and they really like you as an individual and a person who's driving it. So you're doing good things in the world. You're doing the right things. So keep it up, and I'm sure your success is going to be huge. So I appreciate your time today.
Thank you so much. Really appreciate the opportunity and just again, so thankful to have a chance to be helpful to such wonderful people.
Okay, well, take care and have a good rest of your day.
Thanks. You too.
Bye bye. Thank you for listening to another episode of Profiles in Leadership. To listen to all my interviews, subscribe to Profiles in Leadership with Steve Anderson on Apple Podcasts, iTunes, and many other popular podcast platforms. Some of these interviews are on video, and you can search YouTube for Profiles in Leadership with Steve Anderson. You can also access the entire library of interviews on my website, orange.coaching.com, and that is orange, the word, .coaching.com, and go to the Media Center and click on Podcasts or Video Gallery. You can also enter the website from pilpodcast.com.